things a women's health physical therapist can help you with if you have pelvic pain. Number one, they can help you figure out if your pelvic pain is because of a trigger point in your pelvic floor or is it the prolapse. Now, technically, by the time you see a women's health physical therapist, your MD should have already told you if you have prolapse, and usually, yes, they have. Number two, a women's health physical therapist can figure out, do you have any dysfunctions in your hip and pelvis that is causing things to be grumpy in the tissues in your pelvic floor? Because ignoring the hips and abdomen, that's not how we roll. Everything is connected in a woman's body. Number three, we can help you figure out if you are having some nerve entrapment symptoms, because if you have pudendal nerve pain, you know what I'm talking about. Stabbing pain in the vagina is never acceptable. So seeing a women's health physical therapist can help you figure out, is it the muscles? Is it the nerve? Is it prolapse? Is it your hips? Is it your pelvic floor SI joint combination? Do you have weakness in your abdomen? Because if you're trying to figure out your pelvic pain all on your own, it is really hard to be objective when it's yourself. So a women's health physical therapist can make you a plan, help you with whatever things you need to change in your everyday life. They can talk to your doctor about what things y'all need to modify. Then, it's real. Women's health physical therapy, seeing somebody who treats a pelvic floor, can help you with your pelvic pain, and staying at home and suffering, I am not about that. So in many states, there is something called direct access where you can walk in and see a physical therapist. Now, I always recommend my women see their MDs, see their OBGYN, make sure everything looks good, talk to them about seeing me, then come see me. In my state, I have direct access, but I work very closely with MDs, and I want my patients to have a team of people that are all on the same page and know how to help them. Also, if I have to go back and talk to the doctor and ask for something, perhaps I have a prescription that I think could be helpful to them, or maybe we need to talk about a pessary, which I jokingly call the pelvic floor orthotic. So having a community surround you, healthcare practitioners that know how to help you, is really important. And if you have pelvic floor dysfunction, I encourage you to talk to your OBGYN. If you don't have an OBGYN, talk to your family doctor, then ask them for a prescription for physical therapy, because pelvic floor physical therapy can change your life. Ask anyone who has had pelvic floor physical therapy and has got better. They will tell you they wish they would have done it sooner. You don't have to be nervous.